Breaking news, Governor Gretchen Whitmer is updates on the state's efforts to fight the coronavirus. Let's listen in.
Earlier today, I went to Sexton High School here in the Lansing area to help hand out food and supplies to families. The Lansing School District, like school districts across our state, has done an incredible job stepping up to meet the need, and they are handing out about 7,000 meals a day at 22 sites, more than 500 every day at Sexton alone, which is one of the many schools. It's so comforting to know that in a time of crisis, there are good people across our state who come together to help their neighbors. I didn't know it was possible for me to be more proud to be a Michigander, but it is, and I've seen some really wonderful things. This is a crisis and it's hard, but we have seen some remarkable Michiganders do some great things. This week has truly brought out the best in our state. We even got University of Michigan and Michigan State University to partner together for a video on what people can do to help stop the spread of COVID-19, and that's impressive. Since I last stood here 2 days ago, my administration has taken more actions to support our families, workers, and businesses during this time. In the past 2 days, I have executed a number of executive orders, expanding child care to our healthcare workers, our first responders, and other essential workers to help us navigate this crisis and to keep them on the front line, knowing that their kids will be taken care of. I have issued an executive order, which is a temporary ban on evictions. We've also temporarily banned non-essential medical and dental procedures, taking action to further prevent price gouging and go after bad actors. People are trying to make money off of this crisis. And yesterday, I announced that the U.S. Small Business Administration has approved our statewide economic injury disaster loan declaration. We were the second state in the nation to have that, and this is opening the opportunity to small business in Michigan to access low interest rates from the SBA. I've also been in discussion with several business leaders across our state about their companies perhaps helping us manufacture some of the things that we are short. Things like ventilators and gowns and masks and personal protection equipment. Yesterday, we did announce that Coppercraft Distillery in West Michigan is going to produce and donate 10,000 gallons of hand sanitizer to healthcare providers in the area next week. Dow is working on manufacturing solutions too. And Superior Business Solutions and Ahmed Boomrad at GDI Integrated Facility Services have stepped up to get more masks to our state. They are all contributing to help communities across the state of Michigan, and we are grateful. There is more to do, and I'm sure there will be more who participate and help out, and we welcome that. This week, I sent a letter to President Trump requesting federal funding for the full use of the Michigan National Guard. The Guard would, under my command, be used to aid in the distribution of food and supplies for families and businesses that have been impacted by the spread of COVID-19. I want to be very clear. There's been a lot of misinformation and rumors floating around. I'm asking for funding for our National Guardsmen and Guardswomen to help distribute food and supplies. Missions. I am not calling for martial law. That is a rumor, and that is false. And it is dangerous for people to foment fear and put bad information. If people have questions about what we are doing and what my administration has done to mitigate the spread of COVID-19, please visit michigan.gov/coronavirus. We must begin to prepare for the long-term economic challenges this crisis will bring. These challenges will be immense, from unemployment to helping our businesses get back on their feet to educating our children. It's not going to be easy, and it is going to take time. But we've been through hard times before, and we've come back. This will be a challenge, but we can come back when we work together. We'll come back stronger. My team and I have been working around the clock to get this right, to protect the most people, workers, and businesses we can from the spread of COVID-19. I ask that everyone does their part. I'm going to sound like a broken record, and you're going to hear me say it over and over again. But for those of you who are starting to pay attention, are starting to see how serious this really is, there are actions that every one of us can and must take to mitigate the spread, to protect our fellow Michiganders, and to limit the impact on our economy. Wash your hands often with soap and water and take 20 seconds to scrub your hands each time. Avoid touching your face. Cover your mouth when you cough or sneeze. Stay at least 6 feet apart from others. And do not go to work if you are sick or if you live with someone who is. If you think you should be tested for coronavirus, please call your healthcare provider. These past couple of weeks have been a challenge unlike any we've ever seen before. But after seeing how people have risen to this challenge, I know we're going to get through this. Whether it's by passing out food with your local school district or just staying home on the couch, everyone can make a difference. There are truly superheroes among us. I'm thinking of the healthcare workers who are coming out of retirement to work on the front lines, people that are putting their health at risk to protect ours. The first responders who show up when we are in trouble. The National Guardsmen and women working to bring food and water to communities. The teachers who have no students but are still caring for our kids. The person delivering goods to the door of a homebound neighbor or elder. And the grocery store employee working around the clock to keep the shelves stocked. We have gotten through 100% of our bad days. We will get through this as well together. Today is March 20th. We should be watching Cassius Winston play his last March Madness, or Juwan Howard complete his first season as head coach. My daughter Sherry should be gearing up for a big celebration for her 18th birthday this weekend with friends and family. But instead, we are at home. Some of us are working 24/7, and it's hard. We must keep our wits about us, make smart choices, take care of our families and loved ones. And instead of focusing on what we can't control, ask yourself, what can I control? You have the power to make some decisions in your life. Think about what you can do here and now. Last October, if someone would have told you you might have a few weeks or a few months to just shut down, you might have welcomed that. Thinking about the list of books you might read, or hanging out at home with your family or your pet, or just written some emails to people that you've lost touch with. Remember, this is a challenging time, but we will get through this. Take every precaution. Make smart choices. Protect those around you. Every hand wash and every person who stays 6 feet from their peers could mean one less day of this crisis. Take it serious, because it is serious. We will get through this together, no matter how long it takes. I'll introduce and turn the microphone over to Dr. Janae Caldoun, our Chief Medical Executive.
Thank you, Governor Whitmer. We continue to see more and more cases of COVID-19 in the state of Michigan. As of this morning, Michigan had 549 confirmed cases. We also know of 3 deaths. We continue to expand our lab testing capacity. Our state lab has tripled its ability in the past week to test, and we can now do up to 300 samples in one day. Several hospital labs are now able to test. Henry Ford, Michigan Medicine, Beaumont Health System, and Sparrow Hospital. We also know that there are several private entities, such as LabCorp and Quest, that are doing these lab tests. And collectively, we believe that we are currently doing about 1,000 tests a day. And as of a couple of days ago, we are now able to receive the results of those outside labs into our state lab reporting system. There's no question that as a country, we started late when it comes to testing. And even though we're able to test now, there's no question that there are challenges with people being able to find a medical provider to actually perform the sample, and there's a limited number of labs who are able to run those samples. We're working very closely with partners across the state to build that capacity as quickly as possible and find a simple way for people who need testing to get that test done. Yesterday, we opened a new 24/7 hotline specifically for medical providers to be able to expedite testing for their patients. And when those positive cases are identified, we have some of the strongest and most knowledgeable local health departments in the country right here in Michigan, and they swiftly identify who could have been at risk for exposure, and they provide guidance to prevent further spread. At this point, however, our testing data will not be able to give us the full picture of the spread of COVID-19 here in Michigan. And that's why, with Governor Whitmer's leadership, we are calling on everyone in the community to take these important public health measures. Social distancing, covering coughs and sneezes appropriately, washing hands frequently with soap and water, cleaning frequently touched surfaces. Our health systems have been working diligently on implementing their emergency preparedness plans, and we have great hospital leaders all across this state. Part of that plan is limiting their elective surgical procedures, which the governor announced in her executive order today. This will keep people from unnecessarily exposing others, and importantly, it will make sure we are preserving critical medical supplies like gowns and masks as much as possible. Those who we know are most vulnerable to getting severely ill from this disease, those who are over the age of 60, those with chronic medical conditions like coronary artery disease, COPD, and diabetes, they should stay home and limit travel unless it is absolutely necessary. If we do these things now and take this seriously, we will prevent unnecessary illness, deaths, and make sure our hospitals and healthcare workforce are able to take care of people when we need them. This is difficult, but I am confident in our scientists at the Michigan Department of Health and Human Services. I am confident in our local health departments, and I'm confident that these proactive measures we are implementing now will slow the spread of this disease and save lives. And with that, I'll turn it back over to Governor Whitmer.
I'd be happy to open it up for questions.
All right, Governor, thank you. Hope this is working. So you've been vocally hitting back against the shelter-in-place rumors that Michigan could do that at some point, but we've seen other states do it. What conditions would have to be in place for a shelter-in-place order to be issued in Michigan, and why are you not deciding to do that right now?
Well, let me be very clear. There were a lot of, I think, there was a lot of talk yesterday on social media, people that were stirring things up and I think creating anxiety and fear and anger based on nothing that was actually concrete or something that's being talked about in the moment. Now, I recognize that not having plans to do something right now doesn't mean at some point we might have to take more aggressive action. We're clearly listening and paying attention to what other states are doing. We are sharing best practices. We are sharing our best medical advice and information that we are using to make informed decisions. and we are constantly monitoring because the information's changing so rapidly. If and when we are in a position where we think that it's an important next move, I will absolutely communicate that personally to the public. We are not there. I think it's irresponsible for anyone to imply, read into, or broadcast anything other than that. Every decision we make has ramifications. They weigh heavy on me and my team. We know that when we close schools, 1.5 million kids aren't getting the education they need. We know that half of them aren't going to get the food that they get at school, and that's why this incredible work that's being done that I saw at Sexton High School today and is happening all over the state is so important. If and when we get to a point where people are not adhering to the counsel of the CDC and best practices and we need to take another step, we will consider doing that when the time is right, but we are not there.
Thank you, Governor. California's governor has said recently that he expects 56% of the state to be infected within an 8-week span. I'm sure Michigan has done all sorts of modeling. Can you tell me what that has shown you and your staff about where Michigan can expect to be?
I'm going to have to hand the medical questions over to the doctor, so I'll ask Dr. Khaldun to come back.
Thank you. So yes, we have been in close conversations with our scientists and other scientists at the University of Michigan to look at the modeling. Right now, to be honest, Michigan has so few tests that have been done that the model is not actually going to be accurate to project out like maybe some other states are able to do. But that said, there are predictions across the nation that anywhere between 40 and 60% of the community will actually end up having the disease. But we are actively working on getting that more specific modeling data.
Dr. Khaldun, this one may be for you as well. Oakland and Wayne County seem to have a high number of cases at this point. Does that reflect better testing in those communities or an actual higher prevalence of any sort?
So that's a good question. We also have the highest number of people who live in that area of the state, obviously, so we would expect more cases. We're working actively to make sure everyone is testing the right individual, so people who do not have any symptoms should not get tested, and those are the conversations we've been having over the past couple of days as far as how we think about those negative tests. I cannot say that there's necessarily more concentrated disease in that area because, I'll be honest, we have not tested enough to get a good idea of what's going on across the entire state.
I think this is best for the governor, but perhaps not. I know in New York, the governor there said he was talking to China to try to get some of their ventilators that maybe they don't need anymore. Everyone's talking to anyone who might have a ventilator that they can take. Are there active discussions right now, and is there any expectation that we will be receiving more ventilators, more masks in the near future?
So in my comments, I announced a few people, a few companies here in Michigan that were able to secure and help us get more masks. I don't have a specific number for you, but I am confident that it is in the millions, and that is something that is great, and we couldn't do that without these great Michigan businesses that are helping out. With regard to ventilators specifically, we have been working incredibly hard and thinking kind of creatively about how do we bring more ventilators online here in Michigan. And I know that the team here at the SEOC, that's exactly what this place is organized for and why we got it up and running back in February before even the first cases were known to be here. And all of the incredible work that they're doing to bring additional ventilators into Michigan or back online, I think is we're going to be able to, is going to bear fruit. Is it going to be what we need? We are so far behind because frankly, the federal government didn't take this as seriously as they should have on the front end. I'm grateful that there are wonderful manufacturers in this state who have offered to help. None of whom build ventilators right now, and so manufacturing perhaps parts of a ventilator, they're incredibly complicated, clearly because they're such an important piece of machinery. But we are working to see how we can, how we can increase the number of ventilators that are available in our state, and I feel like we're making some progress, but if the federal government is able to procure ventilators and, ship some of them to Michigan, we would be incredibly grateful.
Have you been able to put any numbers on the number of ventilators Michigan has or the number we need?
Dr. J.
Yes, so we do query all of our hospitals across the region. As of a couple of days ago, there were over 1,000 ventilators available across all of our regional healthcare coalitions.
This could be for either of you. Have there been any discussions about potentially having to use dorm rooms, for example, as hospital rooms, or to increase the hospital bed capacity should we need it?
Yes, I'll start and then Governor absolutely can chime in. So absolutely, part of what we're thinking about as far as healthcare workforce and capacity is also bed capacity. So that's part of what all of those hospital coalitions have to send to us is how many beds they have available. And we're also working across the state to identify where there may be additional spaces where we could actually have hospitals. And we're ordering hospital beds and other supplies in the same line.
I have one for the governor. Has the possibility that K-12 schools may not be able to reopen this school year been discussed, and what kind of contingency plans would have to be in place for that?
Well, you know, at this juncture, we are 1 week into the 3-week the 3-week shutdown that I initiated, a temporary shutdown. Our plan and hope is always that we'll be in a position to get back into school. But of course, we're very aware of what the science is and the experience has been elsewhere, and so we are working hard to ensure that we can give kids the education that they need while they are not actually physically in the classroom. I know that MDE put out a statement today. I was dismayed to see that, frankly, and we are going to work to make sure that kids are getting the instruction or the equivalent of an instruction as needed so that they can finish this year and having gotten the education that they're supposed to get.
Governor, the Big Three have announced the closure or the pausing of manufacturing, but in most cases, it's not been a hard and fast stop. It's been a gradual shutdown. A number of employees who have had to come to work have reached out to us very concerned that they're still in these conditions that the Big Three have decided should not be running. Should it be a hard and fast shutdown in your view?
You know what? I've come to find that it's rarely wise to weigh in on the discussions between the Big Three and the UAW because they have been working together to make sure that they are keeping the members of the UAW, the hardworking men and women who are on the line, safe. And so what I would say is that it's not an easy decision to shut down, but it's also the most important thing is the health of our people, and I commend them for recognizing that and working with the UAW to ensure that there was a decision that was come to jointly. And I think, you know, I'm hopeful that the impacts on our economy from COVID-19 are impacts that we are all aware of and that we are all determined to make sure that we keep it as short and as and we mitigate the depth of it.
Governors in some states have closed daycares. Why keep them open here, and would you consider closing them at some point?
I know that a lot of facilities are not still open. I had to take extraordinary measures to create some opportunities for our first responders to have places where they can have confidence their kids are safe while they're on the front line taking care of everybody. And so every decision that we made, as I've said, has weighed heavily on me, that there are ramifications from each that we have to take measures to help mitigate the harm. And so one of which was trying to ensure that our first responders and our primary care folks have got care for their children. As we think about what we all rely on every single day, especially in a health crisis, it's those people that are showing up every day and putting in incredible hours and doing tough work. So we want to help them.
I understand this is the last question. It will sound similar to the first question, but I'm going to try to make it a little different. California, Illinois, New York have all instituted some sort of a shutdown. I imagine that the governors in those states wish they had done it sooner. A week from now, how concerned are you that perhaps you might be looking back thinking, I should have done it on this day?
As I said before, we governors are all talking to one another regularly and sharing information, and I think it's important that we understand the thought process. And in Illinois, most, I think, pertinently to our situation, I want to make sure that Governor Pritzker and I have an opportunity to talk about it. I don't know that a week from now, a day from now, things are changing so rapidly. We are continually reassessing and analyzing the data and the outcomes and the impact. And I think as all things we've seen over the course of the last 10 days is that things are changing rapidly, and I know that that remains true. All right, well, thank you, everybody. Thank you, everyone who has tuned in. I hope that you do your part. I ask that you do your part. This is a serious time, and it's a tough time. But the tough times don't last. Tough people do, though. Thank you, and please do your part.